The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I have a returning guest on the program today. Excited to have him here from Awaken to Sleep. Chad Wooters, say hello to everyone.
Hey everyone, stoked to be here.
Yeah, and just for those that are wondering, you want to plug it in later, the website is Awaken, the number 2, and then sleep.com. So check that out when you're done listening or anytime during your listening. Chad, you guys are doing some pretty awesome things in dentistry, right? You guys are sleep coaches. You're helping dentists bring this into their practice and have success with it in their practice. Why don't you kind of tell me about your journey a little bit? Tell me how you guys started, what the kind of the background is to Awaken to Sleep, and where you're at now.
Yeah, so I actually started with Michael Cohen, the founder of the company. He was a pediatric sleep technician trained at Loma Linda University here in Southern California. And through his classic sleep tech training, he actually eventually saved his daughter's life. And you can hear the full story on our social media sometime. But she was 5 months old and was having severe apnea. The pediatrician later told them if it wasn't for his sleep training, his daughter likely wouldn't have been alive to make it to her scheduled sleep test in the hospital. And so there's a whole cool story about how he jerry-rigged, helped his friend who owned a sleep lab do his first pediatric test, all that kind of stuff. And it started Michael down this journey of helping providers, first in the medical field and then eventually dental, really be equipped to go out there and help more people. We started off as a testing company, helping practices test their patients, but quickly found out that our skill set, our passion, and our drive lies in coaching, training, and educating practices solely in dental sleep medicine, because the reality is, and I know you know this, Patrick, but there are hundreds of patients in every single practice, unless you're a big practice, in which case you have thousands of patients in your practice who are really waiting for you to talk to them about their airway, about sleep, so that you can help them get into compliance. And so we help practices treat more sleep. That's what we do.
Yep. So let's talk a little bit about the practices that have hundreds, right? So maybe a smaller than an average size practice. And I think a lot of doctors get into sleep medicine because they're thinking, hey, you know, insurance keeps getting tighter. It's harder and harder to make reasonable profits in dentistry. So let me look at TMJ, or let me look at clear aligners or ortho or sleep, right? So that kind of comes up. And I see, it seems to me like some practices fail at this, right? And implementing a financially successful sleep business into their practice. Tell me, what are some things that can be done? What do you see that practices they're doing to make sure that this is it financially pays off for them?
Yeah, that's a great question. When practices want to succeed in sleep, they got to take a step back for a second and look at what their goals are. When you're starting to treat sleep apnea, or really any new procedure, the first step that most practices do is go learn to treat that procedure. That's the number one mistake we see in dental sleep medicine, is that practices try to learn how to operate this new procedure, new workflow, new everything for the whole team. And then they also try to learn medical billing at the same time. Now, please hear me. Medical billing is an amazing tool to be leveraged down the road for most practices.
Sure.
But to get started, you have to just learn what the basics are. Learn the workflow, learn the verbiage, learn how to talk to patients. And you can do that while making money on a fee-for-service basis. Make a list of the patients who said no for medical insurance and revisit those down the road. And in that time, you have an opportunity to do a couple things. One, you actually get to see how well your team learns and implements a new procedure. Two, you'll actually start to see the transformative nature of this treatment in your patients' lives. You'll start to see how sleep will save the restorative work that you're doing. Because if you patients with sleep apnea go untreated, it's going to cause more cracked crowns, more fillings to fall out, more bruxism. Sure. We can reduce that by treating this. And what's extra fun about this protocol, we call a fast start protocol, is you get to make some money. Make money, help people, and learn to see if this is a good fit for your practice. And that all starts with taking a course or just talking to people, offering them sleep testing, and trying to make a handful of appliances.
Yeah, makes sense to me. Now, on your website, you go to other services. You have a store there where there's quite a few kits that will help dentists really kind of get up and moving in this. And one of the things that I was looking at and kind of got curious, of course, in the marketing side of things, is doing outreach to medical practices in your area. What are some What are some successful things that you've seen that doctors have done to reach out to their brothers and sisters that are physicians to bring in business? What does that look like, and what are some things that you can do there?
Great question. Yeah. So remember that the physician community on average has less than 8 hours of education in sleep. So when we go in and say, hey, we've got this cool thing, they've only heard about the over-the-counter stuff that messes up people's teeth, and they're just super, super skeptical. And they also don't fully comprehend the impact of an untreated sleep apnea case a lot of the time. And so there's a couple things we can do to help with that. One is we can start telling people, our physicians locally, that we actually treat sleep. That's the first thing. They don't know that you do this. So most of your patients have a physician. They may not have seen that physician in the last 5 years. Chances are they have one. So start collecting those physician information and just notifying them that you do treat sleep. Or if you start a treatment for a patient, let them know that you've ordered a home sleep test because of X, Y, and Z factors, or that patient has agreed to start treatment under the advice of a physician. That's important. They want to make sure that they're being respected in that. So notifying them of that. The second thing is you can reach out to them with referral pads, reach out to them with literature on how effective this treatment is, and offer to connect with them, do lunch with them. And then if you really want to get crazy, offer to get them a sleep test, offer to make them an appliance, show them how this is different than that over-the-counter one that hurt their friend's TMJ. You know, your appliance, your work, your practice can provide this life-saving treatment to someone and make a big difference. Now, I will tell you, going back to medical billing, many physicians, I'd say somewhere around the 70 to 80%, are going to ask that you do medical insurance. So that's going to be a consideration there. But if you have patients who at least want to talk to you, you can at least start that conversation, start building awareness, and go on that route.
Yep. So medical billing, that's kind of next level. You should be treating a certain amount of cases before you really want to take that on, right, and make that part of something that's in your practice at some point. It might not be cost effective, but then if you're doing more than a couple of cases per month, it certainly can be. What does that look like? What does it look like to get going? What are some of the pitfalls? What are some of the challenges, and how do you overcome those?
Yeah, and I would actually say you don't have to have a certain amount of production to get medical billing started. You can, and that is a good indicator. That's a lot of what we try and help practices get to. You just have to be comfortable with the foundations first. Learn to place a single unit implant before you do an all-on-4, right? So same thing with sleep. Learn to treat sleep cases, learn your workflow, and then inject complexity into it. Don't do it at the same time. But what does it look like to do medical billing? It's very different than dental. First up, we've got to do pre-authorizations, which are not like predeterminations. We've got to see pre-authorizations are kind of like a speed bump. If we don't slow down and go over it, it will really jack up the process. And so we have to say, hey, are you willing to cover this? Then we've got to make sure that the sleep test is authorized, the appliance is authorized. We have to check the deductible, check how much of that's been met, kind of similar to the dental insurance model. And then we have to present that to the patient. The challenging part about medical insurance, the biggest pitfall, two big pitfalls. One is that Medicare has made some changes in the last couple of years that have made it really difficult for testing and appliances to get covered. For medical insurance companies that follow the Medicare guidelines, then there's some extra workflow hoops you've got to jump through to make sure that test and that appliance is actually going to be covered at the end of the day. The second hurdle is that they won't pay for appliances until after they've already been delivered. And that's really challenging because now the patient has left your practice with a removable device that they can say they lost, they haven't found. And if insurance doesn't pay you, which they are not legally required to pay you until 30 days after you submitted the claim with their approval of all the documentation, which sometimes turn into 60, 90, 120 days to get all that approved. Now you're out of pocket all this money production wise and with no guarantee of payment. So once you get that practice, that workflow, that situation that's ready to go, this can turn into a comfortable situation, but it takes time to refine those systems.
Yep, makes sense. So that's a big headache, right? Or you're talking about a big headache, but there's a way to calm that headache down, right? There are ways to make sure that there's SOPs, that there's a process, there's procedures in place, or even people or outside people in place to make sure that goes smoothly and it's easy peasy, right?
Yeah, we're typically SOPs. Most practices who are getting started with medical billing are using a third party, which is a best practice. You got to find the one that fits well for you, that monitors all the steps in that and does a lot of that work. There's a lot of hounding of our medical insurance companies for those claims. So finding a third party can work out really well. But if you're just starting, you're looking for really something to just get your teeth into this situation and just see if it's a good fit for you, just keep it simple. People will pay you cash today to help them with this problem if you understand how to position that. And you can learn if sleep is a good treatment for you before you go spending all this money on the education and the software and the tools. You can actually help people make money and then see if you want to expand it from there.
Yeah, makes sense. So I know you guys offer a lot of value to dentists and dental practice across the country. You got quite a few things going on. You've got coaching, you've got an academy. Where's a good place to start? People want to learn more? Obviously, go to the website awakentosleep.com. But kind of if they want to tip their toe and they don't want to fully dive into working with Awaken to Sleep, where's a good place to start?
Yeah. So first, if you want to talk to a coach, we're happy to learn more about your situation and just give you a free coaching call. You can find that link on our website. If you are kind of not sure what category of learning about sleep, our website has some great information to help you figure out where you are in your sleep journey. That's there. The other two places I would say, if you want to try out our online academy, we have a promotion. It's $1 for 1 month to try it out for you and 5 team members. We have 80 CEs or over 80 CEs in that platform for you if you want to check it out. I would recommend, my number one favorite is come interview us for a day. Come bring your team to a virtual course. We've heard it's one of the most interactive courses you can, and we only charge $800 for you and 5 team members to get 7 CEs each for a 1-day virtual course. And it'll give you really everything you need to figure out if sleep's going to be a good fit for you in your practice. And it's going to be fun. Lots of bad jokes, lots of good education, and just a really great bonding time for the team.
Awesome. Chad, thanks so much for coming on the program. Chad Wooters, wakentosleep.com. We're thankful to have you here.
Thanks, Patrick. It was great to connect.